I've struggled with this my whole life. Just made me so insecure. It's life-changing. Thank you, Dr. Lebowitz.
This is Dr. Lebowitz at the Long Island Gynecomastia Center in Long Island, New York. Gynecomastia is what I do. I do it more than anybody else in the world. This is the specific operation that I do, and I do it 2 to 3 times a week, at least 2 per day. I'm available 24/7. All my patients have my cell phone number. I see them on Saturday, I see them on Sunday at their requests. Why come to me in Huntington, Long Island, New York? I have patients that travel from around the world. The Middle East, United Kingdom, Ireland, Asia, Europe, Northern Africa, Canada, a lot of patients from Canada, and of course from around the USA. California, Florida, New York, of course, that's where I am, and everywhere in between. Again, experience, let's talk about that. This is what I do. I do, again, as I said, more than anybody else in the world. My main 99% of the operations that I do is gynecomastia, male breast reduction surgery. Passion is there. This is what I do. I hope you can see this through my YouTube channel, through my Instagram, from just talking to people. If you Skype or FaceTime with me, my passion is out there. I enjoy doing what I do. As they say, if you love what you do, you never work a day in your life. I'm available 24/7, nights, weekends, Saturdays, Sundays. You need to speak to me, I'm available. I offer Skype and FaceTime consultations, and really when you want me to do it, I'm available. Obviously, I'm in surgery a lot of the times, but late afternoon, Saturdays, Sundays, I'm available to Skype or FaceTime with you. There is an art to gynecomastia surgery. I just don't do liposuction if I do high definition work. I lipo-sculpt, I lipo-contour. Sculpting the chest is very important. You want to leave bulk up on top to give a lifted, happy chest from a deflated, sad chest. So I sculpt the chest. I go from the back, the latissimus dorsi muscle, the pectoralis major muscle, the lateral, and the inferior border of this. Again, I want to do fullness and volume up on top. I create this gorgeous deltopectoral groove where the shoulders look phenomenal, immense, and perfect, and gives people just a lift in their whole sense of well-being. Posture is also very important. I instruct people on posture. Stomach in, chest back, core strength, shoulders back and down. This is the way you want to present yourself. And this is what makes your chest look amazing. And finally, science. This is my Vaser machines. I've got 2 of them. I'm one of the only ones in the world that has 2 Vaser machines. Why do I have 2? Because this is what I do. I have people coming to me from around the world. If one laser is down or breaks, I have a second one. So I'm never at a loss for my science technology of Vaser. Speaking about Vaser, Vaser is high definition work. It steam heats the fat, steam heats and melts the gland, whittles it down. I lipo-sculpt, I liposuction, lipo-contour the chest. And finally, if we do the Vaser, I also do the gland. You have to do the gland. Get rid of the tissue, get rid of the issue. People who don't need liposuction, don't need Vaser, we do gland, and I do that to perfection. I also create a lifted chest. I've got my special quilting stitches, which lifts the muscle, lifts the skin, gives you better high definition up here, and less bulk on the bottom for that perfect lifted, happy chest. Never recurrence, and if any recurrence happens, it's on me. My touch-ups are free. I do Power X, which is that roto-rooter thing, which makes the melted fat and melted gland come out like butter. I sculpt and contour the anterior aspect of the latissimus dorsi muscle, and also the lateral and inferior aspect of the pectoralis major muscle, creating a gorgeous negative space here, into the armpit, across the chest, that rhomboid shape here, that male cleavage that we like, and I leave fat here and bulk here because I want that lifted, gorgeous chest. Curved cannulas. I invented these curved cannulas, and that sculpts and contours the chest. I make a perfect rounded chest into a chiseled, squared off chest. that can also go down into the rib cage here or along the rib cage to scoop out that negative space between the positive space of the pecs and the positive space of the latissimus dorsi muscle. I got my baby cannulas. My baby cannulas fine-tune things. The deltopectoral groove, for example, gorgeous. Get that great muscle, that great shape to that deltoid muscle. You will look fantastic. And finally, my graded cannula. From The Walking Dead, I call it Lucille. And that scrapes underneath the gland so that when I remove the gland, it's whittled down, as I jokingly say, from a hamburger to a slider. The results are permanent, never a recurrence. Also, if you book with me and you cancel for any reason you wish, I refund your money 100%. I do not keep a cent of your money. Cost-wise, I'm expensive. Let me be straight with you. I'm more money than other plastic surgeons who do gynecomastia maybe twice a year, 3 times a year, even once a month. I do it 6 to 8 times a week. This is what I do. I know the male anatomy of the chest. I keep the muscle intact, never an indented nipple, and it's a high definition result, perfect and guaranteed results. Thank you for watching this video. Any concerns, any questions, you're my patient, you're not my patient, call me. This is what I love to do, and I'm honored to speak with you. Dr. Lebowitz, Jonathan Lebowitz, Long Island Gynecomastia Center, 631-424-0101. Thank you for considering me and the Long Island Gynecomastia Center. Call me, text me, email me. Hope to see you soon. Thank you.